Okay, this is going to be a review of just the basics of neuromuscular diagnostics. To study for the exam, it helps to place the information side by side to view the differences. Starting with multiple sclerosis, there is no single diagnostic test that is proof positive. There is a set of accepted criteria for multiple sclerosis diagnosis. Since it is difficult to diagnose, it must be done by a neurologist who specializes in treating MS. Ultimately, the diagnosis relies on ruling out other conditions that might produce similar symptoms. Analysis of blood can help rule out some infectious or inflammatory diseases that have symptoms similar to MS. Cerebral spinal fluid, it may show an increase in oligoclonal immunoglobulin G. Also, it may contain a higher number of lymphocytes and monocytes. A sample can show abnormalities associated with MS, such as abnormal levels of white blood cells or proteins. It can also help rule out viral infections and other conditions that can cause neurological symptoms similar to those of MS. A magnetic resonance imaging could be a diagnostic tool for MS. An evoked potential test measures the electrical signals sent by the brain in response to stimuli. An evoked potential may use visual stimuli or electrical stimuli in which short electrical impulses are applied to the arms and legs. Evoked responses are often delayed because of decreased nerve conduction from the eye and ear to the brain. Looking at this scan, you'll see to the left is a healthy brain. To the right is a brain damaged by lesions or plaques caused by MS. Inflammation and demyelinization is occurring in the bright areas, which are called lesions. Here you will see the comparison between CT and MRI images. The MRI shows an increased sensitivity and adds in visualizing the brain lesions, such as those that you see in MS. Diagnosing Parkinson's disease is sometimes difficult, since early features may be difficult to assess and may mimic other disorders. For example, a tremor may not be apparent as a person is sitting at rest, or posture changes may be written off as osteoporosis or simply a sign of aging. A diagnosis of Parkinson's is most likely if they have two of the three cardinal Parkinson's signs and symptoms: tremor, slowing of motion, and muscle rigidity. Onset of symptoms usually start on one side of the body. The tremor is more pronounced at rest, for example, when the hands are resting in the lap. Significant improvement is seen with levodopa. There are currently no sophisticated blood or laboratory tests available to diagnose the disease. A CT or MRI are done because there might be brain changes that are microscopic. And it's also useful in ruling out other conditions like brain tumor or stroke, which can produce similar symptoms. A positive emission tomography scan is used to measure dopamine neurons in the substantia nigra area of the brain. The symptoms of Parkinson's are caused by the loss of the dopamine neuron. 18-fluorodopa is injected into the patient and then the brain is scanned. The scan is very sensitive to the dopamine cells, and many people with Parkinson's will have an abnormal PET scan. The Tensilon challenge test is useful in diagnosing myasthenia gravis and in distinguishing myasthenic crisis from cholinergic crisis due to its rapid onset and short duration of action. A positive response is not completely specific for myasthenia gravis because other conditions like ALS may also respond to the Tensilon with increased strength. Once a patient has an airway secured, an initial test dose of Tensilon is given. Some patients may respond noticeably to a small dose, say like a milligram. If there's no adverse reaction occurs following the test dose, then another dose, about 3 milligrams, would produce noticeable improvement in muscle strength within 1 minute. If no improvement occurs, then an additional dose of 5 milligrams can be administered for a total of no more than 10 milligrams. Patients who respond generally show dramatic improvement in muscle strength, regaining facial expression, posture, and respiratory function within a minute. During this procedure, the patient must be monitored carefully because Tensilon can cause significant bradycardia, heart block, and asystole. The return of muscle weakness after Tensilon wears off combined with a residual increase of oral secretions can exacerbate respiratory distress and the risk of aspiration. Cooling may improve neuromuscular transmission, and in a patient with myasthenia gravis who has ptosis, placing ice over an eyelid will lead to cooling off the lid, which leads to improvement of the ptosis. Additional tests like a standard electromyography, single fiber electromyography, repetitive nerve stimulation, assays for acetylcholine receptor antibody are used to confirm the diagnosis of myasthenia gravis, but they're usually not available on an emergent basis. A blood test may reveal the presence of abnormal antibodies that disrupt the receptor sites where nerve impulses signal the muscles to move. Repetitive nerve stimulation. This is a type of nerve conduction study in which the electrodes are attached to the skin over the muscles to be tested. Small pulses of electricity are sent through the electrodes to measure the nerve's ability to send a signal to the muscle. To diagnose myasthenia gravis, the nerve will be tested many times to see if its ability to send signals worsens with fatigue. Single fiber electromyography measures the electrical activity traveling between the brain and the muscle. It involves inserting a very fine wire electrode through the skin and into the muscle. Most people who have this test consider it to be somewhat uncomfortable. And then the imaging scans are done to see if there is a tumor or maybe an abnormality in the thymus. Amyotrophic lateral sclerosis is difficult to diagnose early because it may appear similar to several other neurological diseases. So tests to rule out other conditions might include an electromyogram, which records the electrical activity in the muscle as a person rests and contracts the muscle. The test is considered mildly uncomfortable for most people. As muscles contract, they emit a weak electrical signal that can be detected, amplified, and tracked, which provides information on how well the muscles are working. These responses are abnormal in cases of ALS. Nerve conduction study. A small shock is passed through the nerve to measure the strength and speed of the nerve signals. An MRI is used to rule out spinal cord or brainstem disease. Cerebral spinal fluid is analyzed for other diseases. Blood and urine tests may eliminate other possible signs and symptoms of other disorders. A muscle biopsy is done if there is difficulty getting a diagnosis. The biopsy would show neurogenic atrophy. An initial evaluation of Huntington's disease will consist of questions about the medical history and family medical history. If Huntington's is suspected, then they may need to meet with a genetic counselor to discuss the possibility of having a blood test to determine whether they have the defective gene. Because Huntington's is an inherited condition, it will be important to do a thorough physical and history and will need to know if anyone else in the family has the disease. The physical exam would pay close attention to abnormal movements such as chorea, as well as balance, reflexes, and coordination. Even though the Huntington's disease is a genetic test and is a simple blood test, it can take several weeks. In addition, brain imaging tests such as MRI or CT will be done to see if there are any other diseases that may produce changes similar to Huntington's disease. The one on the bottom is a normal brain. The one up top is a Huntington's brain. There is no single test that can diagnose Alzheimer's disease. It does require a full assessment that includes an accurate medical and psychiatric history, a neurological and physical exam, lab tests to rule out anemia, vitamin deficiencies, and an evaluation of the person's ability to do common daily activities such as managing finances and medication. A mental status exam is done to evaluate a person's thinking and memory. This scan shows a normal brain and an advanced Alzheimer's diseased brain. This shows the difference between normal aging, Alzheimer's, and PICS. PICS disease usually strikes adults between the ages of 40 and 60 and is slightly more common in women than in men. While the cause is still unknown, there is a strong genetic component. Because the frontal lobes affect behavior and emotional response, people with PICS disease will usually show signs of changes in personality before they show evidence of dementia. This may be an impulsiveness or lack of inhibition. While the progression of symptoms in PICS disease is slow, symptoms do worsen over time.